Well, infectious disease experts are sounding alarms about what's happening right now in Florida.
Florida is now really at risk, and time is really of the essence.
For weeks, the governor has reassured us the COVID spike is not tied to reopening and not tied to the mass protests. He said it's just due to increased testing and acute outbreaks in certain places, but the data keeps telling us a different story.
I said when we reopen, we're going to double testing. People are going to say, oh my gosh, there's more cases.
Well, to the governor's point on that, yes, you can expect to see more cases come to light as you test more people, but that does not account for the dramatic spike that we've been seeing now for weeks.
Now we're dealing with spread.
And the governor finally recognized that this weekend.
That you're seeing increasing transmission.
He said transmission is accelerating, and particularly among young people and particularly across Central Florida.
Particularly in the Tampa Bay area.
And he warned that those young people who are catching it can now easily expose parents and grandparents and coworkers and older, more vulnerable people all across the state.
But in terms of spread and in terms of some of the vulnerable populations, eventually seeping in there, certainly a cause for concern.
Again, because the spike we're seeing is not just due to acute outbreaks and increased testing, as the governor had been saying for weeks.
As we've gotten into May and then really June, it's been consistently in about the 30,000 test results a day.
And that's an important point. The governor just said the number of tests have not changed much since late May. When the governor says we're doing so many more tests, he means compared to March, April, and the first part of May. So the number of new tests each day have leveled off for weeks as the number of new cases keeps skyrocketing. Now compare that to what was the epicenter of the nation's outbreak. ProPublica data mapping tracks testing per 100,000 people per day from state to state. And relative to their populations, it shows states like New Jersey, New York, and Rhode Island have ramped up testing more than Florida. And in each of those states, the numbers of new cases per 100,000 people are going down. And here you see in Florida, they're going up. Now let's take a look at the percentage of tests that come back positive, because that's a leading indicator of whether the virus is fading away or accelerating. By Friday of this week, the rolling average of positive tests shot up to 8.2%. To put that in perspective, look at the left side of this chart. That's right in line with where we were the week of March 15th to the 21st, just before the outbreak took off. Except the infection is now rising faster and steeper than it was in mid-March. Again, that 8.2% was from Friday. This weekend, look at this, it shot up to 11%. Now look back at the chart. It took 2 weeks to rise that fast in March and April. It took 2 days this weekend. And that 11% is already higher than what was Florida's peak back in April.
You're seeing more transmission in the communities.
Meanwhile, New York, which has ramped up testing as Florida has, is seeing the infection rate there go down. In New Jersey, the infection rate is low and holding steady, while the needle continues to move in the wrong direction in Florida.
Obviously, you're looking at ICU hospitalizations, very important indicators.
To that point, we're not meeting the goal on that either. And local governments across the state have issued mask orders because a lot of people appear to have let down their guard.
I'm seeing a lot of carelessness. I'm seeing people walk around without the mask.
A part of the problem there is that some people don't think they do any good, and that's partly because our government sent mixed messages on that early in the pandemic. The research and science now show masks can make a big difference in preventing further spread, but we did not have that information a couple of months ago.
And if you're not sick, you shouldn't be wearing a medical mask. But if you are, then you should.
Yeah, the World Health Organization initially discouraged the public from wearing masks if they did not feel sick. And then on March 8th, America's top infectious disease expert pressed that same point on 60 Minutes.
People should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask.
And some people still remember that. And that's one of the reasons why some people are not wearing masks in public, perhaps not realizing why the experts reversed course on it in April.
That we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms.
We discovered people with no symptoms can easily transmit coronavirus. And we did not have a shortage of masks that would have deprived our healthcare workers and first responders and vulnerable populations as experts feared we might back in March. Reserving masks for people who do not feel sick no longer made sense because many would not know if they are sick. By wearing a mask, you protect others from the possibility that you may be infectious and don't know it.
If everybody wears a face mask, then you're protecting the other person.
The bad news is that the models are now giving some dire projections for Florida, with a spike of fatalities yet to come. But the good news is that the models have overestimated once before, and the people of Florida can change the trajectory of this by changing what they do.